You're listening to the Wellness Evolution Community Podcast. I'm Dr. Christine Smith, and this is where your body becomes something you understand again, because symptoms aren't failures. They're your body's most honest attempt to protect you. Each episode, we decode those patterns with root cause physiology, nervous system insight, and metaphors that make your biology feel alive, understandable, and trustworthy. You are smart. Your body is designed to heal. Let's remember how together. Welcome to the Wellness Evolution Community Podcast, where today we're going to explore the concept of what if the pain you're trying to shut down in your body is actually one of the most intelligent signals it has ever sent you. And I'm so excited to have Dr. Jordanna Quinn with us today, as she works at the intersection of regenerative orthopedics, longevity science, psychedelics, and cellular transformation. She honors the body as an adaptive, brilliant system that's always communicating, and her ability to track structural, biochemical, emotional, and relational layers all at once is rare. And her perspective is very much the evolution that this field needs. So I'd love to start by asking you, what originally pulled you into medicine, and when did you sense you were meant to practice in a different way?
Well, I actually was watching a PBS show when I was 14 years old of an eye surgery. And I thought immediately, I want to do that. And I knew that I didn't want to do that exact thing, but I was like, I want to be a doctor. And I never looked back actually since that time. So I knew immediately that I loved humans and I love people and I love puzzles. And I kind of felt like being a doctor, I could work with people and figure out the puzzle of their physical being. And so in that, I was probably in junior high then, so I went to regular school, but I've always actually also been more holistically medicine minded. So even when I was looking into going to medical school in college, I was kind of like, I don't know if I want to do Western medicine. Like it seems so strict and it just seems so Western medicine, whatever that is to different people. And so at the time I looked into going to traditional Chinese medical school. I looked into becoming an osteopath. I looked into all of these different things. And I'm an osteopath, which is pretty traditionally trained medical doctor. But in addition to regular medical school, we learn just a little bit of a more holistic approach to how the physical being is connected to the nervous system and to the rest of your being, like how your musculoskeletal nervous system is affected or can be affected by your internal organ system as well. So I took a little less traditional approach, although honestly, the trainings are very parallel. So in medical school, during medical school, we have to give for different body systems. We actually have to always give a lecture in front of our class. So for a cardiology system, we have to give a lecture, and for the pulmonary system, we have to give a lecture. And so I always gave the holistic medicine talk. And so that's just been me forever. I don't know exactly when that moment arose, but I think I was raised very much, honestly, as food is medicine. We ate all natural food all the time. My mom didn't even let us eat ketchup growing up because it had sugar in it. So we were very strictly raised from what we ate. And then I was an athlete. So I was a gymnast my whole life. So food was very important in terms of what we ate to fuel the body. So I had maybe an innate sense of how food fueled the body and how exercise fueled the body. And so that was just kind of my path in life.
Beautiful. I love that. And I have been lucky enough to receive some of your body work, and it is such an important thing in care. And I think it's really missing from a lot of our conventional systems of integrating that physical being into the concept of healing as a whole and a whole person and holistic health. So I know you tie the physical being in by really working with regenerative medicine, and then we'll talk about the rest of holism as we go through the podcast. But when someone asks what regenerative medicine really is, how do you describe it, and in a way that includes the cellular optimization work that you do?
Well, I don't know that I often describe it in terms of the cellular optimization work that I do, but regenerative medicine means so much to different people. But I am board certified in physical medicine and rehab, which is anything that makes you not move normally. So I did my residency in head injuries, spinal cord injuries, non-operative orthopedics, neurologic conditions, rheumatologic conditions, anything that makes you not move normally. And actually part of the reason I picked that as a field of medicine was because I knew from the beginning it required being in partnership with your patients, because you can help them achieve the goals they want, but they also have to work at it. And that was a big part of medicine when I was going through the different medical school trainings and doing different rotations. I really felt like people would go see their primary care doc and honestly blame their doc for not having their blood pressure good enough or their diabetes good enough. There was less taking responsibility of their own health. And that was such a turnoff to me. And so I knew that if I went to physical medicine, right, if you had a spinal cord injury, I mean, I can't sit there and move your legs for you. I can a little bit, but you actually have to get up and want to try to move your legs, and you have to put in effort. And so I really knew I wanted to partner with people in their health, and I wanted to meet them at 150% of their health, but they also had to take responsibility for their health. So regenerative medicine, I mean, I do mostly regenerative orthopedics. There's some regenerative medicine in other fields as well that I touch on, but I'm mostly doing it to prevent the need for orthopedic surgeries. So we'll do stem cells or PRP or exosomes to prevent the need for knee replacement or meniscus repair or rotator cuff repair. And so I describe it, I mean, as using your body's own ability to heal itself. And so we're inducing an injury by sticking a needle into that area, and that's going to stimulate blood flow to the area just by itself. And so no matter what we put into the needle, we can enhance that even more. So honestly, if I stuck an empty needle into your knee and just stimulate it, right, that's something called like a tenotomy, we are going to induce healing. We're going to increase blood flow. Your body's going to send its own platelets, and your body's going to send its own stem cells, and you will have a result.
It brings the body's attention to it. And
Correct.
I love that old saying of where attention goes, energy flows, and blood follows.
That's right. Exactly. And so then whatever we put into the needle, whether it's platelets, PRP, or exosomes or stem cells, that can enhance that treatment and enhance the healing and the regeneration even further.
Beautiful. So I'd love to bring a little bit of understanding to these different treatments for people who have maybe never heard of this. I know we've talked about this before, but I had gone through my own experience of avoiding surgery by doing regenerative medicine and regrowing a centimeter squared of bone and cartilage in my kneecap, which is awesome. And I have an MRI to prove it. And I ended up doing prolotherapy mixed with PRP, which stands for platelet-rich plasma, and then a round of stem cells from my own body. And I know you have opinions on the best forms of stem cells for care and things like that. And then I followed up with another PRP and Prolo. So basically 3 treatments over a couple months. And within 8 months, my knee was back to normal after a year and a half of it being a disaster. And I snowboard on it. I do athletics on it. I do my very physical job with it now. So the fact that it healed like it did is amazing. And I have to take a little extra care of it, but I was able to avoid restructuring my knee in my 30s, which was such a blessing. So can you tell people a little bit about like the different levels of those treatments and where maybe like peptides and exosomes come in, maybe working from like the bottom of like, just the empty needle all the way up to kind of the higher level of care?
Yeah. And then I know you had asked about cellular optimization, cellular transformation.
Yes.
We can touch on that kind of after, because I think it's an adjunct.
Yes.
It's not one or the other.
The body also has to be prepared.
The body has to be prepared. And actually, so before I go into regenerative medicine, I mean, I do think it is important what you are eating and your lifestyle and your supplements or things you're taking do actually help prepare your body, right? And so all of that plays a role. And so you could just go to a regenerative medicine practitioner and quote unquote get stem cells or get PRP. But if you're smoking cigarettes and drinking alcohol every day and not exercising, you're just not going to have the same result as if you are providing this beautiful, nourishing environment, right, to grow your own platelets and grow your own stem cells.
And that also includes our energetics, which we can touch on after this.
Absolutely. Absolutely. So it all plays a role, right? I mean, you need to till the soil first, and then you need to plant the right seeds of the stem cells, and then you need to take care of it afterwards. And so it is to get the best outcome for really anything in life, but the regenerative medicine procedures, you want to prepare appropriately in tilling the soil, and then you want to have the most optimal seeds so you can take supplements or eat the right diet to enhance the cells that you are producing to make them more functional and more viable.
And give them the building blocks they need to do their job.
And then in optimizing your cellular health, when I'm putting the stem cells or platelets into your, let's say your knee, you're optimizing that environment so that the cells don't die as quickly, or so that they actually are stimulated to repair better. And so all of the things you're doing are actually important. So that is kind of where the cellular optimization comes in, and how I talk to my patients about whether it's regenerative medicine or other longevity medicine things we're doing, or psychedelics, or some of the other things I do in my clinic. It all really is important to get the results you want. And so So going back to regenerative medicine, like you mentioned, I mean, I talk about, or I like to describe it as there's really 3 to 4-ish things that we can do for regenerative medicine in terms of orthopedics. There's something called prolotherapy, something called platelet-rich plasma, and then something called exosomes and something called stem cells. Prolotherapy is the oldest form of regenerative medicine. It is taking a needle with a noxious substance, typically a sugar solution, and injecting it into an area. Your body doesn't like sugar. Shouldn't eat it. Except your brain thrives on glucose. So it is important. But anyhow, too much sugar is a bad thing. And so we inject sugar into areas of injury. And again, it's stimulating that blood flow so your body comes and heals. And when you send blood flow to an area, it's laying down more collagen. So I will often do prolotherapy in someone who's had maybe a lot of like a whiplash injury or a lot of stretch injuries or dislocations. Instability, exactly. Because it comes in a bottle, so you can use as much of it as you want in a treatment. And it really does help lay down new collagen and tighten those ligaments and tendons. Next is something called platelet-rich plasma. And so I like to call platelets the general contractors of your bloodstream, right? And so imagine you cut your skin. Well, and so you bleed. And in that blood, there's platelets. And platelets first serve to clot the area so you don't just keep bleeding and bleeding and bleeding. And then they're also calling their buddies called growth factors and stem cells and cytokines and all of these beautiful healing devices to come and heal the area. And so they form, a scab at first. And when you have the scab, even under that scab, then these growth factors and these stem cells are healing and forming new skin. And stem cells are coming from your blood. There's stem cells in your blood that don't know what they're going to be yet, and they have to be stimulated to be told that they're going to become skin or bone or whatever. There's actually stem cells in your skin that know they're going to be skin, but they haven't been called into being skin yet. So those stem cells are being called. And then there's stem cells in other places of your body as well. And so after time, that scab falls off and, you have maybe like a pink scar tissue. And as you will see over time, that scar becomes less and less and less. And as we get older, the scar doesn't become less and less and less as much. And so you can actually see this beautiful process of healing over time. Kids heal so well, and then, older people heal less well. And so, but that's essentially what we're doing inside of your body, right? So the platelets are stimulating all of those things to happen. And then we can use stem cells. We can use your body's stem cells, or we can purchase stem cells. They're not FDA approved, but people do purchase stem cells to help heal the area. And I call stem cells being the worker bees, right? So you can either, hope and pray that when the platelets go out and call for stem cells in the area that they're going to come, or you can just go recruit the stem cells and stick them into the area. And so you do get a much more robust response when you put stem cells directly into the area of injury. But not everything needs stem cells, but that's kind of the order of how I like to describe the different regenerative medicine procedures.
That's perfect. I love that. And if I were to recap for people, a summarized way, I think of it as the prolotherapy is like sending a signal to your body, hey, come heal here. Mm-hmm. And then the PRP is like, hey, come heal here with a few more signals, and here's some bricks for your building.
Yes.
And then the stem cells are like, hey, come heal here, here's the bricks, and here are the workers.
Correct.
So it kind of depends on the level of injury. And so mine, we did stem cells because I had a bone lesion. We needed to regrow the bone, but that's not for everybody. If you just have some ligament instability like you were talking about, sometimes a small little single round of prolo can make a world of difference and stabilize stuff. And then it stabilizes the rest of your fascial structure. And then you're less likely to have other injuries, and it lowers the inflammation because you're no longer having this chronic inflammation cycle.
Correct.
So I think this stuff is really cool. And one of the things I wanted to bring up, because I'm sure people are like, wait, what did she say? Was you mentioned psychedelics in there. And I think it's one of the coolest integrative parts that you do in your practice. And this goes back to that very first foundational component of cellular optimization we were talking about, of correcting the energetic environment. Mm-hmm. So when do you know in your practice when that might play a role for someone? And how do you like to approach it?
People come to me for so many things because I work in the longevity space. So probably 25 to 40% of my practice is sports medicine, regenerative medicine. Maybe 30% of it is, or 40% of it is all of the longevity stuff, hormones, peptides, kind of like the quote unquote things. And then I don't know what percent I'm at, but 20 to 30% is the psychedelic component that people come directly to me for. But the key is, or the foundation or the commonality and all of those things, I'm doing the same intake on every single patient that walks in my door. And so just because you have knee pain or just because you have anxiety, we're talking about, what are you eating? How much are you exercising? How much are you sleeping? What are your stress levels like? What do you do for fun? What are your relationships like? All of these things. What do you do for work? Do you like your work? Do you have friends? All of these things are important in health, and all of these things are worth talking about with patients. Now, it doesn't mean that, so I do a very detailed history because people know what they want, but they don't necessarily know what they need to fix them, which is my job. And I love my job, and I love keeping up with the latest and greatest in health and all of the different changes. And you can look things on chat and you can look things up on Google, but you still don't maybe know how to make sense of it all, nor is it necessarily all right. And so no matter what you're coming to me for, so let's go back to something like knee pain, right? I'm asking about all of those things. Now, it could be that we do just go on, well, quote unquote, I say just go on to, let's say, do a stem cell treatment, and we decide that is the best treatment for you. But even in my office, if we decide that stem cells are the best treatment for you, they are all 100% of people are talking to my nutritionist to make sure that they're eating foods that are going to till that soil and make it more rich for the stem cells to be laid down into their knee. They're going to be put on supplements that are going to optimize their cellular health, get their mitochondria to work more, decrease inflammation in their body. They're going to hopefully be on a good exercise program. They're going to do some hyperbaric and some red light and things that really just enhance that environment that we're going to put the stem cells in. But there are some people who, I talk to, let's say they do come to me for knee pain, but they have a whole story about their knee pain. They were maybe in a high level athlete, and then they were in a car accident and destroyed their knee. They tore their ACL, their meniscus, their whatever they tore. And they have so much anxiety or anger about that car accident because it
creates
changed
a whole identity crisis.
It's a whole identity crisis, right? And so it changed their life, and they're still very angry about that. Well, I can, again, do the same thing with stem cells and nutrition and hyperbaric and red light, but guess what? They're still holding on to that anger. And until they release that anger, that knee is just not going to get as better as they want it to get. Of course, like the stem cells are going to help, and they can help significantly, but you really have to deal with the whole aspect of the person if they want the transformation that they're looking for. And so that would be a time where maybe we start discussing psychedelics, or at least we start discussing their mental health. I spend a lot of time with my patients, and I get to know my patients. And so it's not just something where someone comes to me for knee pain and I'm like, great, let's stick you on some ketamine and then we'll see what happens, right? It's a whole vast conversation, and it's relationship building, and let's, see what people are open to. Some people, and psychedelics aren't the way for everybody by any means. But even just addressing that identity crisis or that psychosocial component in whatever way, whether it's telling them to do therapy or see a sports psychologist. There's so many different ways that you can address someone's mental health, but that can't be a part that's avoided because you're just not going to get or the results that you want, right? And I want results for my patients more than anything else.
Well, there's a whole book by Dr. Candace Pert called The Molecules of Emotion. And it's all about how emotions actually have molecular effects, and it's almost like sand in a grandfather clock, and it's not going to work correctly. The cell can't work correctly when it's backed up with all these repressed emotions. So when people just kind of, I'm going to put it at the back of my mind, or it's okay, I just don't go on that street anymore and I just avoid it. It's like, no, that's avoidance. That's not processing what's actually there. And if you're not processing the identity crisis around your injury or whatever's coming up for you, or even in Eastern medicine, low back pain is often associated with lack of support and resistance to authority. And so it's like, if there's something in your life where you're having those emotions and this back pain has been chronic and you've done everything else, or you try regenerative medicine and it's not working, there might be an emotional component there to address. So I actually think that's huge. And you've had really good results with clients in doing it.
Yeah, I actually had someone who we did a stem cell shoulder treatment, and he got, let's say, 75% better, but he wasn't quite where he wanted to. And he actually went off, not with my clinic, but he ended up doing a psychedelic journey a couple months later. Shoulder pain was gone.
Fascinating.
I know. And he was like, I had no idea that my trauma was stored in my shoulder, and it was a very clear just connection for him. And I loved that. He called me to tell me he was very excited about it. And so yeah, I've seen so many things. Well, let's back up for a minute. I never, as a physician, thought I would be facilitating psychedelic journeys or putting psychedelics in my practice, right? That doesn't make any sense from the physical medicine standpoint of what I went into. But for me, 7 years ago, I had a journey, and it changed my life. And it changed my life in ways that are subtle, but also profound. And one of the main way it changed my life was just this 15-minute journey turned into 2 months of me being a completely different energetic being. I mean, nothing bothered me. I had very little kids at the time, and I didn't yell at my kids. My husband was a stay-at-home dad, and I had just opened my practice, and I would go into work. I didn't know I had anxiety until it was gone. I would go into work with no fear, and intellectually nothing had changed, but energetically I was a completely different person of just I've got this, and just this innate knowing of I could handle it all. And it was, more powerful than I can describe. But part of it also was, it came to me you have to offer this to your patients. And I actually struggled with that for a year. I was like, there's no way. That's not why I became a doctor. People can go do these things elsewhere. But it made so much sense to me from a longevity standpoint and from a mind, body, spirit connection that you really can't get over your knee pain, or you can't get over, your physical being if you can't deal with that emotional. It was just so clear to me. And it's not 100%, right? Sometimes we have pain, we break our leg, we stick it in a cast, we move on, it doesn't hurt anymore. So it's not, it's connected 100% of the time, but it's not 100% of the time that, your pain isn't going to go away if you don't deal with your trauma or your emotions. But psychedelics are just such a quick, beautiful way of being able to see yourself outside of yourself so that you can deal with the internal struggles that you're telling yourself in a very different way.
So what are some of the misconceptions around psychedelics that you would love for people to understand more, or understand in a way that's maybe more constructive?
Well, I don't, really know what people think about psychedelics. I guess, what I thought about psychedelics before I tried them, when people would tell me, oh, I took mushrooms and my depression is gone, I would just think in my mind, okay, you just want to take drugs. Honestly, that's what I thought. I was just people are looking for an excuse to just take a substance and be outside of themselves and disconnect. I also, way back when I started, or when I was early in my training, I used to work with addicts. So I had just a very assumed that people were looking for a way to disassociate and disconnect and not feel. But psychedelics are actually a way that you feel so deeply and so meaningfully and so strongly that you actually, you realize that you have to feel to heal. You have to move through the emotions to be able to move beyond them. And so to me, that was, I guess, the biggest change of realizing many people aren't doing psychedelics, or maybe even most, to escape. They are doing it to deal with things, or maybe they are doing it for fun, but then they realize that they've transformed afterwards. I think another misconception that comes into my office a lot, though, for people who are looking to do psychedelics, is people still looking for a thing to fix them, right? And
Yes.
So people come to my office all the time wanting to do a psychedelic journey. And the way that they're talking is can you give me the thing so that I can transform? And I think that is the biggest misconception in all of medicine. We have tools in our toolbox to help people. We can do manipulations, we can do injections, we can give people supplements. But the biggest realization that people need to realize is the healing is within, right? And so I can help facilitate your journey on psychedelics, but you have to want the transformation and you have to look for the transformation, but it still takes effort. So just because you're in my office for 2 hours or 3 hours doing ketamine, or, in a retreat, on another psychedelic, the transformation takes time. So the transformation might happen during the journey, but the transformation also is important to set your cellular health up for success beforehand. Be intentional going in, decrease screen times, watch what you're eating, exercise appropriately. The transformation can happen after the journey. We're rewiring your nervous system and your brain. And so I think a huge misconception is that the thing is going to fix me. It still takes your own effort to heal yourself.
I think that goes for any prescription.
Right.
And I could not agree with you more. And it's one of the main reasons that I started this podcast and this community, was to remind people that you can heal yourself. And our grandparents gave away our health to somebody else decades ago. And that's really not how it should be. If you expect to have something heal you or somebody else heal you, and they give you a pill, and then you just like ignore the condition that you're dealing with, and you don't give it any intention or any intention, you're not going to get very far because you don't have any of the energetic life force driving the healing. And that's why I think what you're talking about is like there's space before and after that's actually more important than the experience itself. That's the integration time. And I think for, anyone who's maybe heard of stories of people having journey of sorts where it doesn't go very well, it's usually because the integration was not done very well. And the integration, I actually think, is the most important part, because the experience itself kind of primes your brain for being in a more malleable state, but then you have to intentionally shape and mold that state into what you're working towards. So I think that's exactly what you're talking about. And I'm really glad that you do that. So in this, whether it's psychedelics or regenerative medicine or a blend of the two, is there a patient whose transformation still stays with you, and like what shifted for them?
I mean, there's so many. I have a patient. I think I have so many patients that have had such great transformations. I mean, I've had patients who weren't, I've had professional athletes who couldn't do their sport, for example, and we put stem cells in their ankle or their knee and they can go back to their sport within a few months, right? I mean, that's an easy kind of very generic story. Obviously, I can't mention names, but I mean, that's happened many times, just getting people back to functioning. I mean, again, as being an athlete my whole life, like that's so important to me, movement and getting people back to living a life they love. I think I've had people who haven't come to me for psychedelics, who come to me for, I can think of one who's still my patient right now, came to me for pain, literally on opiates, just wanting more opiates, and not from an addiction standpoint, but from a true like chronic pain standpoint. And she's actually still on opiates, but we have done stem cells in her knees and she can walk, and she actually was on disability and on Medicaid and really not living life. And now she has a job and she's helping others and she's living her life. She still has very serious chronic pain, but she's actually able to live her life. She's been my patient for almost a decade, and we've moved on to doing some ketamine with her, and her psychology is so much better. I mean, she can handle life. She has a relationship. She was a complete just mess when I saw her initially, and now she's a completely different person and helping other people and influencing, people positively around her. And there's just so many transformations like that. Like, again, really, I think what I do, I don't know if I do it best, but part of what I do is really help people get out of their victim mentality mode, right? So life happens to me.
So huge for healing. So huge.
It's so huge. And we all have it. I mean, some of us have it stronger than others, but going back to like the knee pain in a car accident, right? You could be so angry that person hit you, but if you can't let go of that anger, and you were the victim in that accident, but if you can't let go of that anger, like you just aren't going to heal.
Well, if I say it super simply, if you're in that state, you're basically in a running from the tiger state, right? It's a fear state. You're in a breakdown state. Your body's in a catabolic state. You are not going to heal if you're breaking down your body because you're in that energetic state. If you exit that state and you come into a state of gratitude and appreciation that nothing worse happened in the accident and you're alive and you're doing well, all of a sudden you have now exited the fear state and you're in an anabolic state, a growth state, a repair state. So it's literally just a neurological state, which we can address in a second. But yes, I totally agree.
Well, it's neurological and it's the emotions of healing and the molecules. All of our cells actually have receptors for neurotransmitters and emotions on them, right? Like, why would an immune cell need a receptor for serotonin or dopamine, right? It, in theory, doesn't, but they are there for a reason. And so it's all of those things combined, right? And so getting people out of the victim mode, whether it's being grateful that they're alive or, seeing what else happened because of that accident or people they met. It's, I think it's a misconception that humans view their lives as, again, going back to like the car accident in the knee, let's say, well, if that didn't happen, you have this like trajectory planned in your life of how it would have been, as opposed to, and so you view your life as a parallel to what it is right now, but maybe without that accident. Like, oh, maybe I could walk normally or, play soccer again, let's say, and I could no longer play soccer. But the truth is just because you got in that car accident, you might not be playing soccer. You might have met someone who took you off to a different country, or you might have been chased by a tiger. I don't know, but it's just, we assume that the parallel life we'd be living, and that's not actually the case. A completely different life would have happened had you not been in that accident which is just an interesting thing to think about, really.
Right. It's where we're like creating that victim state in our own mind from something that wasn't even real and never even happened because it's a perception of our own projection of the future.
Yeah. Or just, yeah, I mean, yeah, it's fascinating.
Well, regarding everything that we're talking about, I know you're always really up to date on science and research, and you've even done presentations at different symposiums. What is the current research actually revealing about tissue healing, inflammation cycles, and as we're talking about the nervous system's influence on repair, and then the different tools that we talked about in the beginning, everything from regenerative medicine to the, very up and popular peptides and exosomes and things like that?
So what is your question?
So basically, what is the current research really revealing about healing, inflammation cycles, and the nervous system's influence on repair, like cellular repair, like we're talking about? And then how do things like peptides, exosomes, and all the regenerative medicine we were talking about earlier play a role?
I mean, I think the peptides and exosomes augment it, right? So again, it's everything we're talking about. I mean, there's specific peptides that work, like BPC 157. I love that peptide for tissue healing and tendon healing and inflammation.
But also has to be resourced, as we were talking about in the beginning, with the right components
Correct.
to be able to do its job.
Correct. And just buying things randomly online. Like, I mean, I see this all the time. People come to me and they're like, oh, I bought this online. And I mean, half of them are not maybe what you think you're getting. I mean, it's a kind of a crazy, dangerous world out there too, which is a whole nother podcast probably, but people can source anything online. I am not going to research if that's a good source for you or not. That's not, my job as a physician is to keep my patients safe. And so I find one or two sources that are legit because they've been researched, they're third-party tested, and they have lots of things. Now they're going to be more expensive because they're third-party tested and researched, and I trust the source. So I can recommend those to patients, but I'm not going to go through online and see everything that people are selling over the counter and make sure they're safe, right? That's not how I view my job. I mean, the latest research, I don't think there's any. So peptides are amazing. I don't think all peptides are amazing for everything. Again, peptides in combination with eating the right diet, eating a low inflammatory diet, making sure you're eating minimally processed foods, whole foods, vegetables, fruits, meats, things like that. I don't think there is a one size fits all diet for everybody. I think you can still enjoy life and probably go out and have a glass of wine sometime. You just can't wake up and have a glass of wine every day, right? I mean, there are differences. It's like you do have to live life. I actually think that it's bad to be so focused on and so perfect all the time, because that's a whole nother psychology of
constant self-criticism is its own breakdown state.
Exactly. Exosomes are something we briefly touched about, but exosomes come from stem cells. They're intracellular vesicles from stem cells. And so they're taken out, they're an acellular product, but when you inject them into people, they start that cell signaling we were talking about. So essentially what they're doing is they're sending out this huge cascade of paracrine signaling into the body that's saying, like, come heal this area here. And so I put them kind of in between in terms of their efficacy, like maybe a little bit more powerful cell signaling than PRP alone, but you really need the stem cells to come and like do the healing. I don't necessarily know the research on inflammation necessarily, but in terms of working in the regenerative and longevity space, what's cool is, I added psychedelics because I had such a transformation and they told me that I had to add it for my patients. And now there's so much research coming out, actually, that psychedelics, I know individually, there's tons of research with ketamine, individually psilocybin and ayahuasca, all that actually improve longevity in very different ways. I know ayahuasca increases an enzyme called telomerase in your system, which actually lays down more telomeres on the end of your DNA. A study just came out recently on ketamine. I didn't read that study yet, but that showed that it improves longevity. Psilocybin has been shown to improve many different cell lines, both in mice and in humans. So I think the research, I just think it's cool that innately I knew that I should add psychedelics to my longevity medicine practice as a way of, enhancing the cellular system.
Fascinating. And I'm sure we'll be continuing to research it, right? And maybe some of it is you're finally processing your emotions in the sand and the grandfather clock, and therefore you are able to live longer because you're not so stressed out.
Right. It might not be such rocket science. I mean, I think that when in some of the psychedelic journeys I have experienced and done, have really realized and felt that psychedelics, I think, are true root cause medicine. I mean, you can get to the heart of disease being, at least there's an energetic component to disease, whether it's the victimhood, whether it's the need to have a name for what is going on, or attaching to the name of what your disease is. But I truly think that psychedelics, we talk about root cause medicine and functional medicine. We talk about root cause medicine, and we'll give you hormones because hormones treat, differently than like treating depression and treating overweight and treating, mood changes. It's like, oh, we can give you hormones, and that is root cause because it treats so many different systems. And that's true. And that is part of it, right? But man, I've really seen and felt that psychedelics can be root cause medicine by getting to the heart of the energetic cause of disease and being able to overcome it in a way that no thing can.
It's subconscious medicine. It's emotional medicine. And one of my teachers, because I practice a lot of subconscious modalities that are a way of working with emotions and processing things at an energetic level without having to dive into the story of things. But one of my teachers for Psych K, she said the environment that you have the greatest exposure to is that of your own mind. And I could not agree with her more. And she was in conventional medicine, she was a naturopath, she was in environmental medicine, and she now teaches subconscious modalities because she believes they're more effective than anything. So I thoroughly agree. It really is root cause because you're actually getting at the deepest sources of what controls your physiology, which is your brain and your internal state and your mind and the wiring that you have. And so like 10 years from now, what do you hope becomes standard practice in this field?
The field of medicine?
Of regenerative medicine or psychedelic supported healing?
In regenerative medicine, so it's so varied. So I've been doing regenerative medicine for between 15 and 20 years now. And let's say 15 years ago, you could only use your own cells. You could do prolotherapy, you could do PRP, and you could do what's called autologous stem cell procedures. So that's when you take your own bone marrow, your own fat, and extract them, and then you stick them into wherever you're going to stick them into to help heal and regrow tissue. And then maybe 10 years ago, umbilical cells kind of came on the line, and that's taking the umbilical cord and being able to inject them into areas of injury to regrow tissue. And so that was the latest and greatest thing. And I think part of it was because anybody can buy it. You don't have to be trained. Anybody can buy a vial of anything and stick it into someone's body and say they're doing stem cells. And so I saw actually a decline in outcomes because I think people were not well trained, poor injectors, and maybe not really knowing what was in the vial and all of these things. So people were saying, oh, I had stem cell procedure and it didn't work. And I always had so many thoughts as to why did it not work? Was it a bad injector? Was it not good cells? Was it your own cells? That sort of thing. And so over time, I do think there are companies that sell expanded exosomes, expanded umbilical cells, and exosomes are better, and we're going there. But I would like to see a little bit of a more standard of care where we know if you're going to see a regenerative medicine practitioner that they've had a specific training, right? Because
Definitely.
like you see an orthopedic surgeon, if they're going to do a knee replacement, whether you had a good outcome or a bad outcome, that they had a ton of schooling. They went to medical school, they went to residency, they did a knee fellowship, so you can like your practitioner or not, but at least they had the training that they needed to do the thing. So I would love to see some sort of standard of training that's like, okay, you had to have the training to understand these procedures to be able to do the thing. And so if people are getting, that way we can assess if people are getting good outcomes or bad outcomes, at least we know it takes a little bit of the like anybody buying a vial online and sticking it into their knee, like out of it, So that's how I feel about regenerative medicine, because my goal is I want people to have good outcomes. I would love regenerative medicine. I would love people to have less surgery. I'd love regenerative medicine to be more standard of care. I think why not, worst case scenarios, I do stem cells on someone, they don't get the outcome they want, and then they need to get surgery.
I consider it preventative medicine.
Correct. But when someone has surgery, you alter your anatomy, you can't go back from that. You're never going to be able to re-put in that meniscus that someone took out, right? So I think it should be standard practice also to minimally invasive, minimally harmful, and helping people in that way. In terms of psychedelics, that's a much bigger question right now. In Colorado, they're legalizing so many things. And I think so many people are in a hurry to start facilitating psychedelics. And that is big. That is like taking someone's spiritual, energetic being in your hands. And so just because you had a psychedelic journey once, and you were like, and now I want to help people in other ways. I mean, I think you need to sit with these medicines many, 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 many times.
You need to clear out your own stuff before you're holding space.
You need to have an experience with dealing with your own entities, with your own shadows. You need to know how to clear your field before you walk into a room with someone. You need to be able to hold that person when they're fighting their own dragons without bringing up your own stuff or without being afraid, and really understand that you have their spiritual being and that they're going to be okay. And I think we're just a little bit too much in a hurry to make that happen. And that being said, and so it's hard because part of me is like, oh, the science behind it is so interesting, right? Like, let's find out exactly what like a mushroom is made of and the quantity of psilocin in it and how much we're giving patients so we can standardize it. But the other half of me is like, well, don't break down the mushroom. It's a living, growing, beautiful being. And if we just took your arm off to study you, how would you feel, right? We can't. So it's like my science mind in psychedelics mixed with like understanding this spiritual, and everything is a living, breathing being, and we can't break it down, and it's just how it interacts with our body in this beautiful way.
The whole is different than the parts.
The whole is different than the parts, and the whole is important. So with psychedelics, I'm not sure where, I want people to slow down a little bit, but I want practitioners, facilitators, and everyone to, again, realize that it's not just the thing that's going to fix you. It's setting up the environment beforehand, and then the environment during, and then the integration afterwards. It's all important. So yeah.
Great answer. Thank you. I'm so glad that we share an opinion on that. Most definitely. So if we were going to leave listeners with 3 supportive practices that they can do right now to enhance their tissue repair and maybe their inflammation levels, what would you tell them?
Decrease your stress. That's easier said than done. This could be done in a way that's literally wake up and just focus on your breath for 5 minutes or even 2 minutes. Just, wake up and take some deep breaths and focus on it. And that is a form of meditation. And I hear all the time, I can't meditate, I'm bad at it. Like, nobody's good at it. I mean, our brains go all the time, right? I mean, Buddhist monks they do 10,000 hours a year. Great. No, they're great at it, but they have the time, right? It's like waking up and saying like, I can't run a marathon. Well, you don't get to just wake up and run a marathon. You start by walking a mile, and then you jog, and then you do it a little more. And so everything takes practice, right? And so literally, if you can do breath work for 2 to 5 minutes once or twice a day, that would help decrease your stress. It would help calm your monkey mind and start changing like your physiology. Exercise. I mean, go on at least 30 minutes of walking a day, and that's minimum. I would love people to do weight training exercise as we age is one of the most important things you can do for yourself. Staying flexible. I would love people to spend more time with their friends instead of meeting them at a bar, go for a walk, or go for a walk to the bar, or whatever you need, but just healthy habits, right? You can walk to work, you can bike to work, you can find ways in this super fast-paced world that's not slowing down, but you can find ways to fit in lifestyle changes into your current life, right? And then watch what you're eating. I mean, eating, you cannot be a passive participant in your health, and eating is one of those things. We all eat multiple times a day. So it shouldn't be a surprise every single day that you're going to want dinner. So plan for it. I mean, health takes planning, health takes time. And so instead of being a passive participant in your sleep or a passive participant in your eating or in your exercise, prioritize it, make it part of what you do, and be unapologetic about it.
Love that, because this helps people come out of forcing themselves, and it starts to create like a genuine partnership with your body. And I truly think that's where healing lies, is like remembering to ask your body questions. Body, what do you need today? Oh, okay. Yeah, we do need to get out and move. And that would probably help our mood. What do you need? Oh, I haven't drank water in 5 hours. I should probably drink some water. And just like starting to have that relationship with their body again.
I hear all the time, I don't have time. And I have 3 kids and 2 businesses that I started ground up by myself, and I have time. And I don't have time actually, but I make the time, here we are.
It is. It's making time. People tease me because they're like, yeah, you plan your life 2 weeks out. And I'm like, yes, in time blocks. This is how I do what I want. But
Correct.
Also like if you and I try to hang out, we usually have to plan a few months ahead. And
yes.
But then when we're together, we have a very present time
Correct.
of being together. And so I think it does take planning. You're right.
Yeah.
Beautiful. If you could offer someone who's drowning in their symptoms 1 sentence.
What kind of symptoms are they drowning in?
Let's just go from there.
Think about that for a minute.
Yeah, take your time.
I think the change starts with you.
Could not agree more. Yes. And the healing doesn't always come from outside of you.
No.
So where can listeners find you and your work if they're interested in this?
So I have a medical practice called Core Regenerative Medicine. It's Core with a K in Golden, Colorado. That's where I do regenerative medicine, longevity medicine, psychedelics. And I have another company called Quintessential Journey. It's quintessential with 2 N's, where I've created supplements to optimize cellular health before, during, and after psychedelic journeys, and before, during, and after regenerative medicine procedures.
And I think that's huge to prime your body with the right building blocks, like we were talking about at the beginning. So I love when we come full circle like that. And then I guess just one bit of closing wisdom for people. For anyone listening who feels worn down by their healing journey, what truth do you want them to hold on to?
I want them to take a minute of not trying so hard on their healing journey. Sometimes healing just takes stepping back and, like you spoke about earlier, feeling your body and just letting it be and honoring it. Things hurt sometimes. It is part of the normal human process. So sit with the pain. It's uncomfortable. Sit with the mental pain, sit with the emotional pain, sit with the physical pain, but maybe sometimes just slow down and don't try so hard. Honestly, what I want to say.
Well, and I'll just come back to that very first thing that we talked about, which is basically, what if the pain you're trying to shut down is actually the most intelligent signal your body has ever sent you?
It's definitely a signal.
So thank you so much for your time today.
Thanks for having me. It's so fun.
Mm-hmm. Thank you for being here and reclaiming your health sovereignty. If you feel ready for deeper guidance and reconnecting to your inner intelligence and finally not going the journey alone, I created the Wellness Evolution community for that exact purpose, for you. It is a place rooted in education, foundational physiology, and community support where you can learn to trust your body again. Visit www.wellnessevolutioncommunity.com for a free quiz to find out where your body is at in your healing stages.